Hi, CHW Hub. It's Nurse Sarah coming to you today to talk a little bit about pharmacoequity. What is pharmacoequity? That is just ensuring that everyone, regardless of insurance status, socioeconomic status, immigration status, has access to affordable medication that they need. Many, if not all, of the patients that we serve take at least one prescription medication. And it's really important that patients take their medication as prescribed, whether that is for treating an acute issue like an infection or for treating a chronic condition like hypertension or diabetes. Um, Not taking a dose of their medication could mean time off work and lost income. It could mean trips to the emergency department and admission to the hospital. And for some people, missing even one dose of their medication could mean life or death. As we all know, medication can be really expensive, and there are many barriers that patients could experience in getting their medication. It's really important that community health workers understand these barriers as well as resources that are available to combat them so that we can help the folks we serve as best that we can. These barriers are typically divided into categories: affordability, availability, accessibility, and acceptability. So, affordability is pretty self explanatory. It's just, does this person have the ability to afford their medication? Do they have insurance? Can they afford the co-payments or any other out of pocket costs that are associated with buying this med? Um, Many people don't take their medication due to being unable to afford it. And this may lead to skipping doses. It could lead to rationing medication so that it stretches or lasts longer, or not taking their medication altogether. I can't tell you the number of people that I've spoken to, even just over the phone since I've been with this team, who just never went to pick up their medication because they knew they couldn't afford it. Um, that just means that this health issue could continue for longer, or the exacerbation that they're experiencing could go on for longer. Availability. Does the doctor's office or pharmacy have what the patient needs? Many medications have been back ordered due to supply chain issues during the pandemic. Um, I've had folks, even in my psychiatry practice that I'm at on Tuesdays and Thursdays, whose medications are, they're just not making them right now. They don't have the stock. So they're having to buy multiple pills to make their dose. So if they can't get their 60 milligram pill, they have to buy a 40 milligram and a 20 milligram pill. So that's two pills now instead of one pill, and that's more expensive. Um, Accessibility. Can the person get to the pharmacy during their operating hours? Some people work long hours or non traditional hours, healthcare workers, right? Um, People who work in the hospital, people who do shift work. Um, they might not be able to get to the pharmacy between 9 and 5 or 10 and 3, depending on which pharmacy you go to. And some people don't have access to transportation. Maybe they don't have a bus card, or they don't have someone who can take them to the pharmacy when it's open. And that would definitely prevent you from being able to get your medication. And then acceptability. So, does this person agree with this medication or this treatment decision? Maybe the reason for the medication and, you know, the side effects and things like that were not explained well enough. Um, Maybe the patient experiences unwanted side effects from taking the medication, or maybe the patient has a cultural or religious belief that prevents them from taking the medication. So, this is where we can do a little bit of digging and try to figure out what the reasoning is behind them not wanting to take the medication. We can use our NowPow ERXs for health education courses. And we can also encourage them to speak to their provider and ask about complementary and alternative medicine or switching prescriptions completely to reduce side effects. In the newsletter, I have included a bunch of links to resources to help with all of these barriers. And then also additional resources where you can listen to a podcast that talks about pharmacoequity and also links to register to vote, um, as well as a nonpartisan resource on voting in your district. Many of these issues surrounding healthcare and pharmacoequity are decided on a state and local level. So I very much encourage you to get out on November 8th and vote. Um, Register with this link. If you are registered, make sure that your address is up to date so that you're in the right district and you're going to the right polling place. Um, anyway, I hope that you all have a wonderful week and I look forward to seeing you all soon. Bye.